Dr. Rick Redden. I'm a veterinarian as well as a farrier. My clinic is in Versailles, Kentucky. My practice is very unique because it's exclusive foot injuries and foot disease. We deal basically with laminitis throughout the world. I've developed many life-saving techniques with laminitis, and this tape is being presented to you as a means to learn step-by-step my methodical approach. I'm teaching technique, and I hope you can learn the skills to execute and have the same results that I have over the years. This little stallion is a great example of how my methodical approach can help you. He had devastating laminitis several years ago, lost one hoof capsule completely, and is fully recovered. I hope you enjoy this tape. Our first case is acute laminitis, approximately 3 to 4 weeks in duration. This is a saddlebred mare that has been treated with the Redden Modified Ultimate since the onset. You can see this mare has been responsive. She started off a grade 3 or 4 lame. She's still quite tender, particularly on the hard surface. See radiographically, she has approximately 5 to 6 degrees displacement. She has a lot of good sole mass. This is very important. This is in her favor. The Modified Ultimate can be put on with or without a shoe. As you can see here, the breakover is straight under the apex. The technique for this particular device, I will go through step by step. This is a layout of the material that I normally will use. As we can see with the shoe, I've designed this to have breakover anterior posterior as well as medial and lateral. The action of this shoe works to relieve the strain of the tendon against the lamina. The ease of forward breakover is quite easy, as well as medial and lateral. I'll place my hand on the top of the shoe. It takes very, very little resistance to tip the shoe in any direction. This gives the horse a chance to choose how they would like to better load the diseased area. You take a combine bandage, cut about 6 inches wide, bandage the pastern, the cornea band using vet wrap. I want to protect the cornea band with plenty of cotton so that when I tape the ultimate on, I'm actually taping to the bandage and not to the foot. This is very important. You can quite easily strangulate the circulation to the foot with the tape. The advanced cushion is a putty type elastomer. This material is heat sensitive. You must be very careful mixing it. Once it's thoroughly mixed, you place it in the bottom of the ultimate. Make it about a 1/2 inch thick. Pick the foot up. As you can see, this horse is quite difficult to pick up. He doesn't want to stand on either one of them very long. It's the advantage of using this particular device because it's basically atraumatic. Use 4-inch elasticon, tape to the ultimate, come up and tape to the bandage. You can now see the advantage of using the bandage around the pastern and cornea band. This prevents you from having to actually tape to the hoof itself. If possible, then you pick them up, do a little figure eight around the bottom. This particular technique I've used on literally hundreds of cases. They can wear this particular setup 3 to 4 weeks. There's no danger of getting out of it, which is very, very important. Once you've put this on and you've disengaged the tendon, you must be careful not to ever let them step out. I'll show you quickly how to do the other foot. As you can see, the material is placed around the bottom and up around the sides of the cuff. Notice how much easier it is to pick up the opposite foot. This particular horse, the left foot, was his worst foot. I prefer to always put the ultimate on the worst of the 2 feet originally. Give about 5 minutes, and makes it much easier to pick up the other one. I actually remove the ultimate once the advanced cushion has cured. Takes approximately a minute or 2. I take a knife and I trim the sole out. Only do this in cases where you have a prolapsed sole. Once the sole has started to sag, I do not like to load it up with contact. Trim approximately a 1/16, maybe an 1/8 of an inch out over the solar area, just below the circumflex vessels. It relieves the circulation in this area. The Redden Modified Ultimate can also be glued on if you have a case that you're not going to be seeing very regular, or you have a feeling that you're going to have a non-complicated case. You can glue this on. Fit the cup up very tightly so it fits the hoof. You clean the hoof up as you would want to glue on any of my Dowrick cuffs. You mix the glue and the advanced cushion at the same time because they're going to cure at the same rate. If you have an area of penetration or abscessation along the toe, be sure to cover these up with tape or putty of some type. Do not allow the glue to cover up any area that may harbor an anaerobe. And you paste the glue in the cuff. Many times I will heat the cuff a bit, but leaves the glue at room temperature so it's a bit heavier. Saturate the glass liner, which is a felt liner inside the cuff. Place the mixed advanced cushion over the back of the heel. Spread it out over the sole. If you have any experience using this particular material with the glue, you might want to apply it first, allow it to set, and then apply the glue. With a little experience, you can quickly use them both together. I will often then take a heat gun and put on the back of the advanced cushion to have it set up quickly. I do not like to set these horses down and allow the weight to push the cushion out, because then I've lost much of my arch support. And use the tape that's included with the kit. Secure the cuff very tightly to the hoof. You need to allow 5 to 10 minutes for the glue to cure properly before the horse can be moved off. It's very important that this horse stands very quietly during the curing process. The advantages of using this particular therapeutic aid is it's very atraumatic. It's quite easy to use. Almost anyone can put this on. One very important point, though, is I designed the Modified Ultimate to be used as an emergency aid. It has tremendous mechanical advantage at the onset of the syndrome. This is the large window for therapy. If you wait until the horse has got displacement or rotation, you have lost the large majority of the advantage of using this particular product. But if in case you have a horse with 5 degrees or greater rotation, you must derotate before using this particular application. This is one of the big misnomers with this particular product. People think they raise the heel even when they have 8 or 10 degrees rotation. It does not work properly in that fashion and has not been designed to offer any mechanical advantage unless you derotate. Once again, this is extremely important.